Hi everyone, welcome once again. As always, before we get started, I would like to briefly introduce Academy, which was created with a clear purpose to bring together expertise from the lab, the field, and public health. We are strong believers in One Health vision, and it is only right to think that real progress happens when these three perspectives work together. Over the past year, Animali has been strengthening its own research department. And during this time, we have developed challenge models for PRRS, for Glasser's disease, for post-weaning diarrhea. And at the same time, we are continuing to expand our work to other pathogens and building scientific knowledge. Okay, so today, Dr. Clavijo, she's a veterinarian and researcher specializing in swine health and production. She earned her veterinary medicine degree from Universidad Central de Venezuela and completed her PhD in veterinary medicine at the University of Minnesota. Her research focuses on ecology and epidemiology of bacterial diseases in swine population, with particular emphasis on improving disease surveillance, refining gilt acclimatization strategies, and optimizing pig flow management as tools for disease control and health improvement. In addition to her research and industry contributions, Dr. Clavijo is actively involved in professional leadership and collaborative initiatives. She serves as a principal investigator for Mycoplasma pneumoniae, breeding herd status, classification committee, and participates in several professional organizations, including AASV, Emerging and Transboundary Diseases Committee, the Iowa University, and the Iowa Pork Producers Associations, and the American Associations for Veterinary Lab Diagnosticians. Lots of works, lots of expertise. So in today's episode, María José Clavijo joins us at Academy to talk about different systemic bacteria that cause fibrinous polyserositis in pigs. And well, welcome, María José Clavijo. How are you doing?
Thank you so much for the invitation and for the ability to be today with your audience.
Okay, so shall we get started?
Yes.
With the questions? Okay. Before we go with the first question, I would like to remind the audience that they can click next to the microphone. There's a button with a hand. In any case, if they want to ask a question, they can click on that button. It will turn color purple. And by the end of the session, we will give you access to ask the question to Dr. Clavijo, okay? Okay, let's go with the first question. So one of the major challenges with systemic bacterial pathogens in pigs, such as Streptococcus suis, Glasserella, is that commensal strains can coexist alongside with virulent strains. This makes in vivo monitoring and diagnosis using traditional microbiology particularly difficult, right? So what alternative in vivo diagnostic approaches or technologies do you believe hold the most promise for involving detection and differentiation of pathogenic strains in the field?
Yeah, no, that's a great question. So the first thing that we need to kind of set the stage and put everybody in context is the pathogenic or let's call them endemic bacterial pathogens of pigs, and primarily these respiratory or systemic pathogens. They are everywhere. So every pig is colonized with these species.
Yeah.
But within these species, you see quite a variation between pathogenic and virulent. So the question that you rightly put was, well, how do we differentiate them? So there's two components to this question. Number one is microbiology will always be the keystone in our diagnosis. We need an isolate. But the problem is that you need to be able to identify that isolate or obtain that isolate from a pig with actual disease and from the lesions. Okay, so that's your first, to set the stage. The first thing that we need to know is that in order for us to do appropriate characterization and typing, we will need to isolate the species or the pathogen from a lesion. from a diseased pig. Okay. Once you have that, then we can have a multitude of typing methodologies that have different degrees of differentiation or discriminatory power. Okay, so from serotyping to virulence typing to next generation typing. And those tools allow us to differentiate between commensal and pathogenic. But one thing that we always forget, and we need to go back to our first year or second year in vet school, is histopathology. It is crucial that we associate the isolate with the lesion. So we need to rely on our pathologists to be able to tell us, yes, there is a lesion, and that's where we obtained your isolate. But the other question that you posed was the in vivo. So when we go out to the field, there's two ways of detecting strep, right? You can say, is this pig positive for strep or Glassers? The second question, is this pig diseased from these two agents? If you just want to diagnose that that agent is present in an animal, you can use tonsil or nasal swab. But that doesn't tell you whether that outcome is from a pathogenic or a virulent strain. So currently, we have ways of detecting or using a tool that allows us to use tonsil or nasal swabs to see if that pig has pathogenic strep suis. We just recently published a paper where you can use one gene that tells you if that pig has a pathogenic strain or is colonized with a pathogenic strain. It doesn't mean that it's actual having the disease, or it will. It's not predicted, but it tells you that that pig is carrying a pathogenic strain. So I think those are the two alternatives that we have. We have a little bit of feedback. I don't know if we can fix that. Are you hearing that? No.
So you hear
a little feedback. As long as the audience isn't hearing that feedback, we can.
Is it better now?
Yes.
It is?
A little bit, yeah. No, I can still hear myself, but that's fine. As long as the quality is good with your team there.
Now?
Let's see.
Is it better? No?
No, I can still hear myself, but I don't know. As long as the final audio or the audience isn't hearing me double speak, then that's fine.
Okay. Does the audience hear the feedback as well? All right. Let's see. I'll move the microphone farther away.
Yeah, maybe that's fine.
Can you still hear me better?
Better.
Yeah?
Yes.
Okay. Let's try it this way. Otherwise, just stop me anytime.
Mute your computer? No.
I can mute my computer when you're talking, maybe.
Yeah, maybe try to see.
That would work. Okay.
Okay.
Yeah, thank you for your question. It was really interesting, the answer.
Yeah.
Let's move on to the second question then, okay? So, accurate identification of systemical bacterial infections in pigs caused by bacteria is further complicated by the existence of multiple serotypes, as you described, that it's something that we also need to do when diagnosing serotyping. Right. So serotype determination is important, but also challenging, right, for the disease control. How important is to accurately serotype this bacteria when we are diagnosing in the field, for instance?
Yeah, also a great question. So I would start off with saying that serotyping is foundational. But it's also where a lot of the confusion, in my opinion, generates. And I think it's precisely because the field has outgrown that technology that I guess we've relied on for decades. So essentially, serotyping, and for both of these pathogens, is a great epidemiological tool or a typing tool that allows us to understand the variation or distribution of our pathogenic strains within a herd. The issue is that you can have a lot of genetic differences between strains that share the same serotype. So there's a lot of recombination occurring, particularly in strep suis. So you may have an identical serotype 2 at the capsular level, but with genomic traits that are completely different. And we see that quite a bit in the industry, or in when we characterize strains from the field. And I'll give you two examples that are pretty telling. So number one would be serotype 9. So when you look at serotype 9, and this is for strep suis, when you look at serotype 9 in Spain and in Europe, you see a lot of disease attributed to serotype 9. But when you look at Latin America, or less so North America, serotype 9 is less of a pathogen, but we detect it pretty consistently. So if we were just to rely on what is known in the literature of like, okay, pathogenic streps, we would be choosing these serotype 9s as important targets for control, when in reality, depending on the region and depending on the strain that you have, they're not pathogenic. So I think, those are the main issue that we have. But absolutely, we still rely on that tool as our first stepping stone into typing. So again, the main limitations now at the tool level is that we don't really have commercially available typing reagents, so the anti-sera. And so I think that, and then this issue that we have of the variation across serotypes makes it a little, harder to get to the accurate diagnosis.
So you don't think that in the future maybe there will be like a fast kit that will tell you the serotype of that strain that you were just analyzing? Do you think this is feasible, or because of all these issues that you just mentioned, it's more like a more like long diagnose?
No, great point. I think we already have them. So the majority of diagnostic labs at a global level, I think, because we don't have the anti-sera, we at Iowa State are very lucky to rely on the support from Dr. Marcelo Gotcha at Montreal, and he's provided this anti-sera for us for decades now. But again, it's a highly specialized methodology. Not a lot of labs do that. So we rely on molecular level to be able to produce a serotype. And I think that, again, is currently the most used typing method. And I don't see it go away. I think, as I said, it's a great first step into typing your strains to see where you're at and deciding what's the next step. Do I further characterize it? Do I, discard it? Keep in mind that in our database, in our experience, about 10 to 15% of all strains are non-typable, usually attributed to non-pathogenic types. So it's always a good first step into discarding strains that you no longer need to pursue for control strategies.
Okay, interesting. Another issue with this type of bacteria is that they require antibiotics to treat it, and because of the issue of antimicrobial resistance, like many veterinarians or farmers rely on autogenous vaccines to control these outbreaks or situations they have in the farm. Do you believe the future of controlling these systemic bacterial infections will increasingly rely on autogenous vaccines?
Mm-hmm. Yes, I absolutely believe that they will. So, but why? I think that autogenous vaccines are there to fill in an important gap. Currently, with what we know, I know there's some future products coming down the pipeline that seem very exciting. But currently, we don't have commercial products that are efficacious across the diversity of strep suis. So while they might protect for a certain type, again, they don't offer that cross protection that we desperately need in looking at the complexity of endemic profiles within swine populations. So I definitely think that those tools are here to stay. However, there's quite a bit of what we say, the devil is in the details. If you are not picking the correct antigen, so we are characterizing a population and we decide to pick in the wrong strains, of course, that's not going to offer you good protection. If we're using an adjuvant that doesn't generate that robust immunity or that robust response, you're also not going to see, and there's plenty of science, again, by Dr. Marcella, looking at the different adjuvants and how those correlate with better efficacy of the products. But also timing and the amount of that antigen within that timing of application, and then the amount of antigen in that product is also determinant. So we do see across the commercial offer, the variation across those things. So again, it takes time to develop a good product. It takes characterizing, and it takes understanding how to use a tool, when to use these tools to make it appropriate. But the other point that I always make with producers or our clients is that autogenous products are not a silver bullet. The complexity of endemic pathogens requires a holistic approach. I know that's a word that gets thrown out pretty, commonly now these days, but it's true with these endemic agents. We can't just rely on a vaccine as a bulletproof or a silver bullet is what I meant to say for controlling these pathogens. We have to control co-infections. We have to provide the appropriate management or appropriate environment for pigs to not undergo any stressing events. We have to, like I mentioned, control viral agents. We have to provide a good immunity in the piglet. So great that you're immunizing the gilt and immunizing the sow, but if you're not really providing that colostrum and making sure that those piglets are ingesting within the first 6 hours good immunity, then you're also going to be, so it's not just relying on one product as a end all for control.
Because I have a question about, as you mentioned, there are many viral diseases such as PRRS or circovirus, influenza, that play a lot of co-infections with bacterial pathogens like Streptococcus suis, Glasset, etc. If you have this autogenous vaccine, do you think the problem will go away, or because you did not go to the main root of the problem, it will just not improve?
Yes. Ariadna, you hit on one of the challenges that we face. If you're not diagnosing the problem in the field appropriately, reiterating, if you have a PRRS problem, you will always have a strep problem, or most of the time you'll have a strep problem. So if you don't control your PRRS and you have a destabilized herd, controlling strep suis or the efficacy of that autogenous product is going to be reduced or limited. So absolutely, we tend to see, veterinarians struggle with, I did utilize this vaccine, but unfortunately, I keep seeing, still a leak of these arthritis pigs or CNS pigs, or if we're weaning also viremic pigs, it's going to be hard to create enough immunity in that pig to sustain that challenge.
And apart from all these limitations you mentioned or challenges when developing autogenous vaccines, such as choosing the right antigen or choosing the right adjuvant, or even the time period that it is needed to develop this autogenous vaccine, are there any other challenges or limitations that we should consider?
Yes. So we mentioned for control or for vaccine development? Anyone? Okay. So I think that for vaccine development, we always have to, which I think is the piece that we always miss, is that monitoring piece. So not only do we monitor to be able to identify the correct number and type of strains going into your vaccine, but you also want to be sure that you're monitoring the efficacy of that product. That you don't have either a strain that you missed and didn't include that's more relevant, or you have an introduction of a new strain that is missed, and now you're out of the suddenly you're seeing more cases pop up. Do you need to refresh your products? So I think that, and then again, monitoring the outcome of that product in your herd. For control, I think that, again, we need to think of these pathogens, or think of control as like your epidemiological triad. We need to think that it's not just a pathogen issue, it's a host issue, but it's also an environment or a management issue, right? So if we're not controlling these three factors, or we're not understanding what of the three factors has the biggest weight in that moment in our herd, then it's harder to prioritize which control strategies to utilize, right?
Okay. Another issue we're facing with these bacteria that are present in the upper respiratory tract, like Glasserella or Streptococcus suis, in terms of research, when we're developing challenge models, for instance, it's really, really hard to like develop the systemic disease as it happens in the herd because of this previous colonization or even kind of immunity they have against these bacteria. So sometimes it's quite difficult to reproduce the disease in terms of experimental or lab level, right? So in Animalia, we have a challenge model for Glassedella parasuis because I think I already mentioned you that, but I will tell you very shortly for the audience. Our herd, we have some sows that are negative for nasal swabs for Glassedella parasuis, but of course this is not a reality in farms. So it's quite difficult to find animals that are suitable for developing this kind of challenge models, right? Right. So knowing that, how would you like make this more? How would you develop this challenge model, understanding that we have animals with previous colonization or even immunity in a lab setting?
Right. It's like the main challenge or methodological challenge that we face in this domain, in this space, right? Is that you're already starting with the issue that you don't have an experimental control. Every single pig is positive or has some sort of underlying immunity towards Glasserella or towards strep that makes it complicated, right? To develop your model. So why you'll have these, pigs that generate some sort of background humoral immunity, and it's variable. You can't really measure it, and it's unpredictable. So you might have, again, low levels of animals with these antibodies, and some won't, or you'll have pigs colonized with some strains that might outcompete the ones that you're trying to challenge or that's carried in the inoculum. So, and then there's multiple models, very little standardization, but the ones that we use at Iowa State, and the model that in our hands is the one that is ideal, would be to use Caesareum derived, colostrum deprived pigs. So they're called CD pigs. So they have no immunity, and they're essentially taken via C-section from these females, right? And that's just because we know that you can actually get strep as they pass through the vaginal canal. So we want a piglet that's perfectly naive. So then these pigs are raised artificially, and then we purchase those pigs, I would say around, and there's a variation, but we normally typically use between 14 days and 28-day pig. And we then utilize a high concentration or high dose of strep suis, so 10 to the 8, 10 to the 9. But of course, you can do IV, which reproduce the disease pretty easily. But we typically like to do a more natural route. So we typically use the intranasal route. Again, this is one of those things that it's amazing. We've done this 3 times now, and you generate a variation in the number of animals that succumb to disease. So as long as your model, and this is one thing that I would recommend anybody doing this, is that to do a small pilot study to determine if your conditions are able to reproduce a disease at 70, 80%, which is the standard that we use. So once you have that, we typically go the intranasal route. However, in order to create a good inoculation or a good challenge model, we have to irritate the mucosa so that you actually have a way of the bacteria, and I'm mainly talking about strep here, mainly going in systemically. So we do acetic acid at 1%. We generate that irritation. Some people use just a very hard brush that generates that damage to the mucosa, and then that's that's what allows the strep to create disease. So of course you want no immunity, no antibiotics in those piglets. Logically, a high dose of strep. Use a known pathogenic strep that we, that's been, previously described. And then the one that we recommend is a CD/CD pig with a intranasal route with 1% acetic acid. Now, again, there's been, papers showing use of conventional pigs with success. Of course, they're challenging with a strain that's not present in the herd with no immunity in the herd. Logically, you have to screen these pigs and they have to be negative for other viral diseases, because then you don't know if it's the other viral diseases that cause the disease and not strep. So I think I covered pretty much the basics.
Yeah, I mean, that would be like the ideal situation in order to have at least reproducible results, right?
Yeah.
Or it really is far away from like a natural infection, because
Absolutely.
you have colostrum piglets, etc. Do you think like this thing that you mentioned, like to erosionate the mucosa of the nasal cavities, would also work with non-colostrum deprived piglets?
Oh, that's a good question. And I believe that there's already data showing that. Yes, I believe that there is. So, but they made sure that the pigs didn't have immunity for the strain, or I believe they just gave a really high dose of strep. But yes, I believe that that's definitely something, because also when you look at the cost, a CD/CD pig is extremely expensive. So just out of this is North America, right? Or the USA. And it's about, you can easily spend $1,000 per piglet. So it's unrealistic, especially for the amount of piglets you have to be able to differentiate or obtain your significant differences between, whatever treatment or whatever endpoint you're looking at.
Right. Interesting. And also still a challenge, right?
Oh, absolutely.
Because what I understand is, even though some piglets are colonized with Placidella or Streptococcus, some of these strains are non-virulent. Even though they are non-virulent, they can still like stop the systemic infection from happening when you perform the challenge intranasal. Is that right?
So you're saying that they create some sort of immunity, like background immunity?
Apart from the background immunity, also like as they have already colonized this area, there's like this kind of
Competition.
for other pathogenic bacteria to like colonize it.
Absolutely. So yeah, that's also a complication or a challenge, right?
Right. Moving on to another topic about diagnosis. You already mentioned some diagnostic tools that we can use, and mostly we rely on microbiology, even molecular, PCR. You also mentioned histopathology. Maybe it's not that common still, but maybe in the future, veterinarians will rely more on this technique. But then there's the new generation sequencing that become like also a practical and valuable tool for the routine diagnosis and monitoring of these pathogens. Do you think this is feasible? Do you believe in new generation sequencing?
Yeah. Well, absolutely. But I think it has a place and a moment for it, right? So I'll give you a little bit of background, but in 2018, we were seeing a spike in strep suis cases at the Iowa State Veterinary Diagnostic Lab. So as a background information, the ISU VDL is the largest veterinary diagnostic lab in the world. receives about 130,000, 140,000 cases a year. So, and then 90% of those or 85% of those are porcine. So imagine the amount of data and the amount of contact with the field that we generate or that we have at Iowa State. So in looking at that in 2018, there was a spike in strep suis cases. And that was mainly because there was a dissemination of a highly pathogenic sequence type 1 strep. And essentially, what we ended up doing is understanding that we needed better tools to characterize these strains and be able to identify the endemic profile of a farm, and then develop better control strategies for that, right? Which was mainly, again, with the gap or the lack of commercial products available, which should always be your first line of use. We had to come up with ways of providing more accurate data to clients. So we developed a pipeline, an NGS pipeline, in collaboration with bioinformaticians at Iowa State, Dr. Ganwoo Lee, to combine 3 pieces of information, which was, next generation sequencing technologies, so state-of-the-art technology. Number 2, what we knew at the genomic level on strep suis and Glasarella and Mycoplasma hyarinus, Hyoscyanovia, multiple species that we've now expanded this service to. And then we added that with the known data from the field, which is what we call metadata. So what organ, what farm, what region, what disease, the histopathology. So while maybe in Spain, which is my experience for the last few years, is that histopathology is not a tool that is used as routinely in the US, it's pretty consistent. I would say about from submissions, about the 90% cases that we receive from porcine, I would say 20% of those include histopath, because reminding the audience that a lot of diagnostics is just surveillance. So a lot is serum and oral fluids just for surveillance purposes, right? But in terms of the amount, we still receive about 20% of cases are histopathology. So it's a tool that gets utilized quite a bit. So anyway, we realized that using this tool provided us with not only the field information, but we were able to add on genomic pieces of information that gave us more understanding of the bacteria and led us to the final piece, which was what's the clinical relevance of this strain in this case. There is so many cases where you get a strain from a case with disease and you identify that strain is not pathogenic. And that's the complexity that I mentioned, right? Runt pig can be colonized with with a lot of different streps, a lot of different Glasarellas. And they could actually be in disease-associated lesions with histopathology telling you, yep, that's pathogenic. But because these some of these strains are able to co-colonize with pathogenic strains, not only that, they're more robust. So they grow better on plates. So you might be picking the colony that is not the one causing disease. So all of that complexity and all of these challenges, we rely on NGS to improve that typing, right? But it's not something that we need to do every day. So that's the other point. So every time I have a case, should I submit to NGS? Absolutely not. One of the good things about, or the fun things about strep suis is that unless you're changing your gilt source, you're not going to add in new strains, or unless you have really bad biosecurity. These are strains that don't necessarily transmit laterally that much. So you have vertical transmission, being from mom to piglet. So whatever is in your moms and in your gilt, it's going to be in your piglets. So as long as you have that very well typed, then you'll be able to design good, control strategies. So that just means that as long as you know exactly what are those strains associated with disease, and you do NGS on a certain number of strains coming from representative cases in a long period of time, 2 or 3 batches that you do, 6 pigs that you characterize. This is very overall what we do. You don't necessarily need to every single week submit strains for NGS, but for sure, identify the pathogenic strains from your herd, use NGS to type them, to design those control strategies a lot better. Once you have issues that you start to see a rise in cases, or you change gilt sources, or it's 2 years and you need a refresher vaccine, then you can do NGS there. So it's pretty much not necessarily something that you need to do every single, week, but there's of course a significant barrier because of costs, particularly in Europe. In the US, it's about $200 a strain. And it takes some time. It takes about 4 weeks to get results. So you have to also put in those things into the design of the whole thing, right?
So it would be more like a technique that you would use, like to get the first information of your farm. Well, you have a PCR result that it's positive. Okay, let's see which one I have, which strain do I have, and moving from this strain, you can do autogenous vaccine, or you can like look for ways to like improve your herd problem.
Yeah, exactly. You got it.
Another thing about this type of bacteria, as you mentioned, there are no effective vaccines, or none, for instance, for Mycoplasma urinis and others that maybe do not work very well in the field because of all these serotypes that we have that are circulating. So do you think it is possible in the future to like develop a vaccine that would be extremely efficient for lots of serotypes? I think this is like a problem that it's hard to like find an answer to. But are you a believer in vaccines that would work on this bacteria?
Absolutely. I am genuinely optimistic, more so than I've been in the last 5 years. But I think we also need to be clear-eyed about the obstacles, right? So I think the first thing is that there is quite a variation in the strains, right? Within, or species variation, right? So there's multiple pathogenic strains. They're different between each other. And we don't have, for most of these, we really don't have a strong hold on what's understanding protective immunity. So I think that for strep suis, at least, we have a promising product that is, I think, in the market, or about to be launched, that seems to be developed with one part of the bacteria that's conserved amongst the pathogenic strains and confers cross protection. So I'm excited about seeing that. For hyarinus, quite frankly, we are still pretty much in the infancies of understanding, protective immunity, what components of provide that protection, similar to GPS. There's some work on like the transferrin binding protein and its potential for immunity. But yeah, I think, with the state-of-the-art like vaccinology strategies, combined with the use of NGS to characterize these strains or these populations, and vast improvements in adjuvant platforms, I think we are getting to a point where identifying those conserved regions, or understanding what is that areas of that provide that protective immunity. So pretty excited about what's coming down in the pipeline.
Okay, interesting to know that. Now moving on to like more field related questions, okay, for clinical veterinarians that might be also attending this interview. So we know that gilts have higher rates of Streptococcus suis or the other types of systemic bacteria, which can create like imbalance in your farm. What strategies would you recommend for vets and producers to both improve surveillance of these bacteria, and more importantly, like reduce the risk of progressing to clinical disease?
Right. So I think that's fantastic. Gilts are probably one of our weakest links between creating that stabilization of the herd. Think about it. 20% at any point, 20% of your piglets come from gilts. So if we're not stabilizing that population and we're not controlling, immunity or creating that balance between immunity and exposure, we are seriously putting a vast amount of piglets in a very weak spot or at risk of having disease. So I think the first thing that we need to think about is think about the gilt not as the same as a sow. It's a biologically, physiologically, and immunologically completely different animal than a sow. It's still growing when we are developing, when it's still growing when they're gestating. So interesting to hear that 30% of what they are needing, right, is going to, that 30% is going to their own growth and not to piglets or producing colostrum. So again, they don't produce as much colostrum. They don't produce as much, cellular immunological components in that colostrum. And it's creating this pig that is going to be a weaker, animal within that population. So the first thing that you need to realize is what is coming in your gilt population. So this is where you have to have an honest conversation with your genetic provider and say, hey, what is the endemic profile of your herd? And that includes characterizing for GPS, for E. coli, for APP. That's a big one. We're seeing, or we have seen, introductions of new strains of APP in this day and age, or strep suis and glasarella, hyarinus, you name it, right? So the first thing is to have a clear understanding of the endemic profiles of the gilts that you're purchasing. The second thing is that you need to be aware of what your actual herd has. So you're bringing in a very, immunological naive animal. And if you don't prepare that gilt and it's coming into a herd that has other strains and it's shedding other strains, then you're also putting at risk that gilt, right? So you also have to understand what's in your herd so that you prepare that gilt in the gilt grow out or the GDU phase, so that you're adapting her and stimulating her immunity so that she doesn't succumb to disease, but also her piglets have good immunity. So I think that, again, what are the ways that you can stimulate gilt acclimation, or you can do gilt acclimation? It's either through vaccines, either it's commercial products or autogenous, controlled exposure, and that is really not utilized for strep or these endemic agents. In the past, there's a lot of, primitive approaches to doing that, like exposing gilts and exposing sows pre-farrow or even piglets to small, low doses of live bacteria. And that in some cases worked really well. In some cases, it actually created a problem, not a solution. And then the other way is just natural contact, right? You are mixing gilts with other sows or older sows in a controlled, natural way, or exposed to the environment. And that's how they start to get exposed to the pathogens and create that immunity. So, I think that's the bottom line, is that rely on these tools, rely on that relationship with your genetic provider to understand what strains are coming in, and monitor.
Yeah, this is like a topic that is coming up.
Oh, absolutely.
Like monitoring is really important in this sense.
Absolutely.
But another issue that happens at field level is the antibiotic resistance, that we have strains that are resistant to many antibiotics, and NGS can be a tool like to diagnose these AMR genes. Do you think this is like a tool that, well, we talked about as a tool to like know the first idea, like the situation you have in your farm, but do you think this is also like a tool that could be used to test for antimicrobiological resistant genes?
Yes. No, that's a great question. And I think it's just another tool in our toolbox, right? That is not necessarily going to replace or remove other tools that we have, like, MIC testing. So essentially, depending on the species, and I'll just give you two examples of when you look at most publications on strep suis more recently, we tend to see a lot of, yes, there's a lot of resistance in the species. Yes, we're seeing that 70% of strains or 80% of strains have resistance towards some sort of, of antimicrobials. But I think in our experience, both in Latin America, Europe mainly Spain, and in the US, pathogenic strains are not necessarily the ones carrying the resistance. So it's counterintuitive. But in our experience, we tend to see the resistance occurring in the non-pathogenic or commensal strains. Again, very counterintuitive. You wouldn't think of that. But essentially, what we see is very low levels of resistance towards the antibiotics that are first line use for control of these agents across. We don't have evidence of, or we don't have strains from continents like Asia. We don't have, and because there's been quite a bit of resistant reported there. And I'm not trying to say that there isn't resistance in pathogenic strains, but we see very low levels of it. So the majority of resistance is occurring in the non-pathogenic strains. Now, if you see E. coli, completely different pattern. Not only are we seeing that the strains causing disease are more toxigenic, they're also more resistant. So again, we have to be careful in this day and age of attributing, antimicrobial use directly causing resistance, because we not necessarily see across the board. And same thing with GPS. There's even lower levels of resistance in GPS, at least again in our database from Canada, Mexico, the US, Spain, Chile, Peru, that we don't see a whole lot of resistance. So, but the other important thing is that if you only look at the genomic level and you're only looking at that, not necessarily translates to phenotypic resistance. So I think that you have to, balance the use of NGS and genomic, or characterizing the resistome, but also looking at the phenotypic level and also utilizing MICs as a tool to understand if you do see that actual resistance in that species, that strain.
Okay, I have a question about microbiota, as
Mhm.
like the commensal strains that are ubiquitous to the upper respiratory tract, for instance, might be the ones that carry more AMR genes. So this microbiota that is there, if we use like preventive antibiotics, do you think like we can destabilize this microbiota and can be more susceptible to like developing later on like a pathogenic strain that maybe was in the beginning controlled?
Yeah, no, that's a great question. It's dysbiosis, right? And we see that actually, again, this is very anecdotal, but I think it's one that we've validated in the field for multiple years now. And so when piglets are pre-weaning, right, or in the lactation phase, they don't have a lot of immunity, right? So what do we tend to do around the less than 10-day mark if we have some umbilical infections or we have castration events happening, and we want to control for that, or we have early disease? We tend to you see systems using a long-acting drug within 10 days of age. And what ends up happening is that while these piglets are under maternal immunity, they're getting exposed with strep suis. But if you cut that with antimicrobials, you're not letting that immunity develop. So you're weaning a pig, maternal immunity starts to wane, and they've never been exposed because you utilize a long-acting drug to cut that. So again, not proven at the science level, but one that we feel pretty sure it occurs in the field, is that with these products, we actually are doing more harm than benefit. And the other point is the dysbiosis that's created with these products, right? Like you're saying, it's disrupting the microbiome that we at this point already know the great, impact that has the gut microbiome, the respiratory microbiome, in creating that stability and that immunity, and protecting that pig towards invasion of these bugs. So one of the theories is leaky gut. So let's say you're already weaning a gilt piglet, right? So a piglet that's already has some sort of intestinal weakness to it. And you are further utilizing antibiotics to and causes more harm to that microbiome. And that leaky gut event has been associated with Strep suis invasion. So absolutely, we just need to weigh in when we need to use these products, what's the most effective timing, and have good diagnosis to be able to, utilize these products appropriately.
Okay, thank you. Dr. Clavijo, as we wrap up our conversation, I always like to ask our guests if there is one take-home message that you would like the audience to remember from today's discussion. Which one would it be?
That detection doesn't mean diagnosis. I think that's the biggest one, is that if you find GPS or strep or hyorinus in a case, it doesn't necessarily mean that it's causing problems. I think you need to collaborate more with your pathologist, with your diagnostician, use typing tools and do some good clinical approach to be able to pinpoint if that strain in that moment is actually a problem, or is it just an incidental finding. Yeah, that would be it.
Okay, thank you. Now, if there are any questions from the audience, now is the time. Just remember that you need to click on the button next to the microphone, and then we will give you permission to talk. So if anybody has a question for Dr. Clavijo. Okay, it doesn't look like anybody wants to ask you a question, or from today's conversation was really clear. Right, so this is the end of the interview. Thank you very, very much for your answers. They were extremely interesting, and I learned a lot from today's discussion.
Ariana, thank you so much. Thank you to your audience and for creating these spaces where, you help tremendously the industry, students, veterinarians, producers to be more informed about diseases. Thank you.
Yeah, right. So there will not be another Academy for the next few months because it's summer holidays,
Right.
but we are coming back in September with the scientific day we are hosting here in Animalia. So it's like it will not be online. It will be here in La Valdaviaña. Okay, it will be on September the 17th. So thank you very much, and see you later.
Thank you.
Bye.
Bye.